Colorado has not seen a Thanksgiving-related bump in COVID-19 numbers, but the governor's office still says 1 in 40 Coloradans are contagious with coronavirus. We will have more on the reasons that surge doesn't seem to be happening in just a moment, but we've referenced the 1 in however many number for months now. Our Marshall Zelinger wanted to understand the math behind it.
The bottom of a news release from Governor Jared Polis last night said 1 in 40 Coloradans are contagious with COVID-19, 2.5% of people in Colorado. Just before Thanksgiving, on November 24th, the number was 1 in 41. 9 days earlier, on November 15th, the governor's office reported 1 in 110. November 5th, it was 1 in 100. And back on August 11th, it was 1 in 900. How the heck does the state figure out how many people might be contagious with COVID-19?
We use this SEIR model. Susceptible, exposed, infected, recovered, or frankly, recovered or deceased.
Dr. Jonathan Samet, the dean of the Colorado School of Public Health, helped me try to understand the model and the math by using an analogy.
Think about, for example, putting water into a sink, and some water is flowing out and some water is going in. The faster it comes in, the higher the water level. And that's essentially what we are doing with the model, saying how fast does it come in.
Is it possible for someone like me to be able to do the calculation myself on any given day?
Well, the easy answer is no, because it's coming out of the model directly. We know how long the water will stay. We know what rate it drains out. So if it comes in faster and faster and faster, water level rises, same as the 1 in X goes from 1 in 100 to 1 in 50.
Now we're seeing number of cases and hospitalizations dropping significantly, which takes us the other direction, where the 1 in 40 should soon become 1 in 50, 1 in 75, 1 in 100. You get what I'm saying.
The hospitalizations have dropped substantially over the last week, roughly. So we're, in a sense now, the epidemic curve is coming under control better. And that 1 in X number should be rising from 1 in 40 to something else. And we look at that every week.
I really wanted to show actual math as part of this equation, and I'm still trying to get an understanding. What I know is that the state multiplies by a certain number because they assume they don't have 100% of the positive cases, and Dr. Samet told me, Steve, that he thinks CDPHE is only getting 35% of the actual positive cases. So as part of that model, I have to assume they're multiplying by almost 3 in one part of the equation to account for the cases they never actually get through a true positive test.
Now I can understand why this is so complicated. A lot of numbers to throw out there. Marshall, we appreciate it.